as we kind of came through the summer and into the fall, we were worried about a viral respiratory surge, given that those had been seen elsewhere around the world as winter came. And we were used to having viral respiratory surges. We hadn't had them really the last couple of years when people were more in kind of in a lockdown mode through COVID. We also had lost significant numbers of nursing staff as people left healthcare through the COVID pandemic. So we were worried about where things stood should we have one of these viral respiratory surges. And then we were hit with what's really been the worst viral respiratory surge in anybody's memory. So we have, over a few weeks, we started to have just massive numbers of people seeking beds here in the pediatric intensive care unit at SickKids to support otherwise healthy kids with acute respiratory illness, mostly from flu and RSV, and to the point where we started to not be able to accommodate all of those asks, and that led to the very frightening situation that we were going to start to have to leave kids in community hospitals where they weren't prepared to care for children who were that sick. The hospital made the difficult decision to close some operating rooms, redeploy nurses who were involved in the care of those surgical patients to come here to critical care, where we could implement what we call a team-based model of nursing care, where we could use our more experienced nurses as sort of team leads and share tasks as opposed to our usual one nurse to one patient kind of arrangement. We were able to change our physician schedule to have more teams, and that allowed us to accept more patients and at least get all of the kids who needed to be here in the door. That has required us to go pretty consistently to 120, 130% of our capacity under normal circumstances. We're running very high census on a regular basis. We have been able to provide the care that these kids need, but again, it's coming at the cost of other kids who need different types of care, not so much pediatric intensive care, but surgical care. It has allowed us, as I said, to address the biggest problem in the system, which was the lack of pediatric intensive care beds. And a bed isn't just a physical bed. A bed is a bed and a nurse and a respiratory therapist and a doctor and a whole team to take care of the patient. Just putting somebody in a bed with nobody to care for them doesn't really solve any problems.